Namaste, good morning, good afternoon, good evening. Greetings to all the eminent experts and the presenters in the session. Welcome to the second day of poster presentation at the LMHI Global Colloquium 2021. Due to COVID times, physical meetings were not possible. It is a great privilege and honor for all of us to come together at this virtual platform to interact with you all. Posters presented orally here will also be available in the e-poster session of the virtual lobby, where speakers can interact with the participants. Participants are requested to be ready with their presentations and stick to time limit. Thereafter, opportunity will be given to resolve any queries from the chair. Theme of today's poster presentation session is Case Reports, Observational, Pragmatic, and Randomized Controlled Trials. Sub-theme of this particular session is Case Report, Cohort Studies of Psychiatric Disorders. For this session, we have two esteemed chairs, Dr. Robert Van Haslin and Dr. Neeraj Gupta. We welcome you, Dr. Robert and Dr. Neeraj. Dr. Robert Van Haslin is the Director, World Integrated Medicine Forum, International Institute for Integrated Medicine Research Consultant. He is chair of the Homeopathic Pharmacopoeia of United States, Ministry of Ayush, India, Joint Committee, which aims to foster a closer collaboration between the HPUS and the Government of India regarding the regulations of homeopathic medicinal products.
I welcome our dignitaries. Now, may I request Dr. Neeraj Gupta to join us as a chair. Dr. Neeraj Gupta is a professor of Organon in Nehru Homeopathic Medical College and Hospital. Welcome, sir.
Thank you.
With the permission of the chair, sir, can we start the session?
Yes, definitely.
Okay, thank you, sir.
Yes, please go ahead.
May I call upon the first speaker, Dr. Answara Dev Atmadev. She's going to speak on a quasi-experimental study on the efficacy of homeopathic antisoric medicines in psychiatric cases. Dr. Answara Dev, you can please share your screen.
Yeah, sure. Okay. Hello, everyone. Honoring late Dr. Samuel Hahnemann, I'm here to present a quasi-experimental study on the efficacy of homeopathic anisoric medicines in psychiatric patients at LMHI 2021, prepared by Dr. Anashwara Dev, Unique Health, Kochi, Kerala State, India, and Dr. Alex Joseph, School of Public Health, Chennai, Tamil Nadu State of India. Issue: mental illnesses are a public health issue. Suicide, the fourth leading cause of death globally among 15 to 29 years, according to WHO. More than 75% of low and middle income group receive no treatment. Conventional treatment is SSRIs, but with side effects. Introduction: homeopathic medicines are beneficial as a major alternative system in NCDs. However, their action remains less studied, standing controversial even in this 21st century. Background: no research papers available on the efficacy of anisorics for psychiatric illness. Study attempts to validate Dr. S. Hahnemann's theory on psychiatric illness. There are three aims: to assess the beneficial effects of anisoric medicines in psychiatric patients, and to compare the treatment outcome of anisoric and non-anisoric medicines to verify the theory of chronic diseases proposed in 1828. Approach explores, as per Organon of Medicine, the chronic diseases and all the writings from 1789 to 1842 of Dr. Hahnemann's with that of clinical evidence using statistics. Next is method. Study design is a quasi-experimental, single-blinded, pseudo-randomized controlled trial. Study setting: institutional-based, Unique Health, India. Study population: psychiatric patients, 11 depression cases, 9 personality disorder, then anxiety, insomnia, ASD, OCD, ADHD, dementia, milestones delays, schizophrenia, mania. Sample size is 40, 20 in each arm after data cleaning from SS93. Inclusion criteria: patients diagnosed with ICD-10, mobile with informed inclusion criteria, violent stage, or any other chronic diseases. Sample size assumptions: expected outcome among anisoric group is 90%, and non-anisoric group has 50%. Alpha error 0.05%, power of 80%, confidence interval 95%, relative precision 10%, and oversampling 6%. Sampling technique is pseudo-randomization. Then study tools. Case analysis with mental status evaluation, structured questionnaires like Beck Depression Inventory, Zanini Personality Test, Hamilton Anxiety Scale, etc. Preparatory use is ISI's Vision for Individualized Stimuli. Years of study 2010 to 2018. Follow-up range 120 to 660 days with an average of 1 year, and all the data is collected in an Excel sheet. Similarly used in totality, anisorics. 2 persons has received anacardium, 1 person adding crude, and then aromet, arsal, baritacarb, punium, carbovage, lycopodium, natriumur, phosphorus, sepia, sulfur, and non-anisorics, belladonna, carcinosin, ignatia, fluoric acid, lacasis, lac defloratum, lilium tick, naja, nexomica, pulsatilla, plumbum, and sumbul. So let's see the results. First is socio-demographic results. Gender 63% females, mean age 51 years, education 7.5%, no formal education, 59% graduation and above. Occupation 43% professionals, equal number unemployed. Residents 80% urban residents, marital status 75% married. Let's see the statistical result. Perform descriptive statistic with analytical test. The test name is Fisher exact test. Let's see the result. Anisoric responded well 17 out of 20, that's 85%, and failed to respond 3, that's 15%. And non-anisoric has responded well is 8, it's 40%, and failed to respond is 12, that's 60%. So here the p-value is below 0.05, that's 0.0079. Yes, the theory written in 1828 by Dr. Samuel Hahnemann is still valid. With a response rate of 2.1250, that's 2 times higher cure rate, and with a confidence interval of 95%, with a range of 1.20 to 3.74. Here you can see the graphical representation. Here the first is non-anisoric responded 60 and 40, and anisoric responded 85 and 15. Here the conclusion is this study is one of its kind to evaluate the subjective as well as objective effects of homeopathic anisoric medicines in psychiatric patients, and it has been statistically validated. Need more studies to critically evaluate the same, as the limitation is small sample size and finding nil, conflict of interest is nil. Acknowledgement to Dr. Lynn Michael, NHC, Washington State, USA. References WHO newsroom fact sheets about suicide, and then Hahnemann's chronic diseases, peculiar nature and their homeopathic cure, translated by Professor Louis Stapel in 1896, first edition by Ringer and Company, first edition, and Hahnemann's Organon of Medicine, translated by Derjanari, 2002, publication by Vijay, India. Hereby, I am winding up my presentation. Thank you each and everyone for patient listening, and LMHI for giving me an opportunity to expose the relevance of Dr. Hahnemann's theory. Thank you.
Thank you, Dr. Anuswara, for a wonderful presentation. Now I would request the esteemed chairs to kindly ask any questions if they have.
Yes, well, if I may start, well, thank you very much for a very clear and very concise presentation. Also, my compliments for the way you have structured the information on a single page. So, yes, very well done. But still, I have a few questions. I mean, for me, the main thing as an epidemiologist is you're ultimately making a comparison. And we need to answer the question, are these comparisons valid? In other words, can there be potential biases in these comparisons? So my question is, I was wondering, how have you defined the psorics and the antipsorics?
Yeah, it's according to Chronic Disease book written in 1828. I can see it's a list of 48 drugs. According to Hahnemann. I have presented in terms of anisoric only according to Hahnemann, no other masters. So according to them, shall I read out 48 drugs?
No. What I also want to know is whether you have predefined those. Was that predefined?
Yeah.
Before you set out.
Yeah. Tell me, sir.
Did you predefine those before you set out with your protocol? Or during the protocol?
It's the list of antisoric is predefined, but the medicines given to patient is not predefined. I have taken the totality of symptoms and then given medicine, and later I have manipulated.
Yes. And the second question that I have is, what exactly have you randomized?
No,
You
it's
said pseudo randomized.
Pseudo-randomized. That means we cannot correctly say that, okay, this patient I'm going to give antisoric, or this patient I'm going to be non-antisoric. Like that, I cannot randomize, or like that, I cannot pick up. So whatever the patients I've given, from that group, I have taken the 20 antisoric groups and 20 non-antisoric groups after cleaning the data.
You have randomly selected from your case database retrospectively.
Yeah.
Okay, so that needs to be quite clear, because when you say randomized, you need to be very, very, very clear about what exactly you have randomized. So you have, over the years, you have treated a lot of patients, if I understand you correctly, and then you have randomly selected from the psoric and the antipsoric pool of cases, retrospective.
Yeah.
Okay, so because I don't like the word pseudo randomized, either you randomize or you don't, you understand? And so then you need to say, what have you randomized clearly?
Okay.
And my final question is, how did you assess outcome?
Yeah, outcome, antisoric medicine has a cure rate of 2 times higher than non-antisoric.
But
because
I asked how?
With assessing their mental status evaluation, their primary symptoms, their secondary symptoms, and the questionnaires I have given for them before treatment, I have assessed the same questionnaire after treatment also.
Okay. So that was done in a standardized way.
Yeah. Only standardized, which is standardized questionnaire in India. Yeah. Because Zanardi personality disorder scale and Beck depression inventory, it's all used in internationally. The same questionnaire is being used for psychiatric patients. And Hamilton scale and dementia scale, everything, only standard questionnaires I have used.
Okay, so that's quite important. I'm glad to hear that, because that's very important, that if you don't do it in a standardized way and it's just subjective, that would make your study weaker. You understand?
Yeah.
Do we have any more questions, Dr. Neeraj?
Yeah.
Thank you, Dr.
Thank you, Dr.
Thank you.
Amrit. It was a wonderful presentation, Dr. Answara.
Thank you.
I appreciate your efforts to have taken this subject of antisoric medicines. But actually, Hahnemann has already proved it, that and mentioned in his Organon from 210 to 230 aphorism that mental diseases are one-sided diseases of psoric origin. And he has mentioned very clearly that unless or until we, in between the lines, we give prolonged antipsoric treatment, these psychiatric disorders are not going to be cured. Well, in the list of drugs, you have mentioned Oromet as one of the antisoric medicine. Oromet, to my mind, it seems to be more of having syphilitic element. So what do you have to say on this?
Yeah, according to Hahnemann, it's not. According to Hahnemann, there are 3 miasms. So syphilis, he has mentioned only Merxol for syphilis. That's purely of syphilitic miasm. And SORA, and the other thing is psychosis, and all other non-venereal diseases he has classified under psoric. And Oromet is one of the main drug of antisoric, and all the other thing, the Oromet having a syphilitic nature and all, it is not while during the time of Dr. Hahnemann. It was a later on, those theories have come up later on by other masters, not by Dr. Hahnemann.
But generally, we understand that aurum metallicum has the suicidal tendencies, right? Suicide and depression.
Yes, sir.
And that takes it towards more of syphilitic element rather than being psoric. So
Sir,
when one more question, like in which disorders you have taken aurum metallicum as your drug of choice as soric medicine.
Okay. So this is a case of Murali, and sorry, I can say, and it was a severe depression with psychotic syndrome with suicidal tendency. He has given Oramet, and according to Hahnemann, suicidal tendency or psychiatric cases is included under developed SORA. SORA can be divided into 3 stages. First is primary infection. Second, when the primary infection without medication, it keeps on going into developed stages. In between, there will be latent soric stage and then the developed soric stage. In chronic disease book, he has written in detail every symptom under developed SORA. It's not syphilis. Under developed SORA, we can see all these psychiatric symptoms.
Okay. Anything that you have mentioned, autism spectrum disorder also. 4 cases you have treated with that. So what drugs of choice as antisoric you have used? Can you comment upon that?
One autism cases, one is Arsal and one is Andincrude, and one is carbonium sulf, but it was a failure. And one is lacosis mutans.
Okay. Did you do anything to study on the potencies also? Your objective does not mention anything to do about the potencies of the drugs you've used.
Potencies, it depends on the sensitivity of the patient and the stage of the disease.
But
so
you should have included, I think.
Okay, yeah.
That is one area you should have to, further develop, mentioning the potencies which are actually important to mention, because in these disorders, mental disorders, psychiatric cases, as per the understanding, the sensitivities are high, and we have to go with the higher potencies, unless or until there is some organic changes, like in schizophrenia and suicidal ideations of depression.
Yeah, sir.
So that is one area I would like to suggest you that in future you have to take care of this also.
Yeah, sure.
Thank you.
Sir. Yeah,
thank you. Thank you, Dr. Anuswara. Just to introduce myself, Dr. Amrit, and my colleague, Dr. Deepika Bhatnagar, would be moderating for the session. Now, I may call upon and invite Dr. Chandrabhan Sharma. He is going to speak on studying the mental state of patients with epilepsy and their emerging remedy profile. I invite Dr. Chandrabhan Sharma.
Is it visible, ma'am?
Yes, please start your presentation.
Yeah. So first of all, good afternoon to all the respected juries and group members. My study title is Studying the Mental State of Epilepsy and Their Emerging Remedy Profile. But the feedback was given by LMHI jury. If the title can be modified to assess the role of homeopathy as adjunct in management of epilepsy, then it will be a good title. So that's why I have modified this title. So the aim of the study was, first, to study the mental state in patients of epilepsy. Second, to understand the importance of mental state while formulating the totality of patients with epilepsy. And the last aim of this study is to study the application of knowledge of mental state of the patient with epilepsy in emerging the corresponding remedy profile. It was a 12 months observational retrospective case series in which 30 cases were selected based on the sample size was calculated by using Y-H-Chan table. The sample technique was used for this case series was simple random sampling. All the diagnosed cases of epilepsy as per ICD-10 included, and cases especially for children who were not able to express their mental state, especially global developmental delay or severely mentally retarded children were excluded, along with malnutrition grade 3 also excluded from this study. And the homeopathic treatment was given as an add-on therapy where already conventional mode of treatment was continued since more than 1 year. Now, the result of this study, as the sample size was 30, so out of 30 cases, the 25 cases are of males and 5% cases are of females. Mostly in 64% cases, we observed the generalized tonic-clonic epilepsies with the idiopathic causes were mostly seen. When we have gone through the varieties of mental state, and we saw the contribution of different mental state in formulating totality to decide homeopathic managements are as in which emotional mental state in 100% cases it's shown reflection in totality. 75% cases shown behavioral mental state under totality. Rest of the 17% cases shown intellectual mental state that shows contribution in formulating totality for such cases. Along with all the 100% cases shown reactions. Reaction in the sense causative, aggravating, and ameliorating modality reflected in the totality of these cases. Now, so most of the cases have dealt with Calcarea group of remedies, that is 8 cases, Natrum group of remedies, again 8 cases, Silica 4 cases, and Tuberculinum 3 cases. So these are the results pre and post effect in which descriptive and statistical analysis separately seen through this table. The pre and post effects of homeopathic medications were seen on the basis of frequency of convulsion, duration of convulsions, changes in EEG, changes in MRI, tapering of anti-epileptic drugs or complete stoppage of anti-epileptic drugs, along with the action of remedy was seen in relation to improvement in associated complaint along with epilepsy, improvement in disturbed mental generals, improvement in disturbed physical generals, or in the course of the homeopathic treatment, any new complaint or new symptoms were appeared or not. So this is the descriptive analysis. In 51% cases, complete stoppage of seizures were seen, along with 43% cases shown 20 to 95% reduction rate in frequency of conversion. In most of the cases where frequency of conversion reduced up to 20 to 95%, the duration of conversion was reduced up to 50% than its previous duration. Out of 14 cases, 50% cases showed normal finding in relation to EEG after taking homeopathic treatment. Out of 11 cases where MRI was normal before the treatment, in 2 cases or almost 18% cases showed normal MRI of brain after taking homeopathic medication. In 30% cases after homeopathic treatment, the anti-epileptic drugs were tapered off in the course of 1 year. Complete stoppage of anti-epileptic drugs were decided by a neurologist in a 1 year of course only after taking homeopathic treatment. Out of 86% cases, associated complaints were totally improved. Out of 15 cases, out of 15 cases, all the 100% case showed positive changes. In relation to disturbed physical generals, out of 19 cases, again showed 100% curative rate. It was observed during whole year. In all the 30 cases, no new symptoms were appeared. Even we could not see any acute condition during the treatment. Yes, there was acute exacerbation of ongoing clinical condition sometimes, but no any other new clinical finding was seen. So this is the descriptive analysis. Simultaneously, the two-tailed pair test before and after was introduced. These are the results. The p-value was compared on the basis of again frequency of convulsion, duration of convulsion, changes in EEG, and so on. So when we could compare before and after treatment, we were able to see there were significant changes in p-value from duration of convulsion to rest of the parameters that we have tried to assess. But in relation to frequency of convulsion, there were little bit confusion as we could not separate simple partial seizures and generalized tonic-clonic seizures. So that was an error, that was an error to decide its significance. Later on, in relation to MRI changes, again we could not see major changes, yet two cases shown positive findings in relation to MRI. But other factors like duration of convulsion, changes in MRI, EEG, or changes in anti-epileptic drugs in relation to tapering of or complete stoppage, along with improvement in associated complaints, disturbed mental journals or physical journals, we are able to see the significant changes, as the p-value of these parameters are less than 0.05%. So the overall conclusion of this study, yes, the study shows studying mental state of patients having epilepsy is beneficial to get sufficient evidences of improvement through homeopathy in management of epilepsy. The limitation of this study is, yeah, it is a very
Apologies to
short.
interrupt, please. Your time has already run out. Please be fast.
Yeah, the limitation of this study is the sample size was very less. So we are not able to generalize it, but over a period in the large population or large sample size, this study can be conducted in future. Thanks a lot to LMHI juries and other group members as well.
Thank you, Dr. Chandrabhan. It is a humble request to the esteemed chairs also that you have a time limit of 3 minutes to ask the questions, please. Thank you. And
Okay.
I request to ask the questions now.
Yeah, so what I don't fully understand is the sample size calculation. Because you've used all kinds of effect measures later in your outcome assessment, but apparently you have done something before you start doing your analysis. And what kind of outcome measure did you use then to support your sample size calculation?
I think he's not able to hear. Dr. Chandrabhan, are you able to hear us?
I think he has to unmute himself.
You're in the question answer session. Dr. Robert has given you a question. Were you able to hear it? Please kindly answer.
No, ma'am. I could not.
Dr. Robert, can you please repeat your question?
Yes, so, well, I can see now a bit more clearly. The one concern I had was that there's a lot of text on your poster. It's better I recommend to have less text and more bigger fonts. But I just wanted about the basis of your sample size calculation. And can you explain that a little bit? Do you use a standardized one? I understand now. Is that correct?
True, sir.
Okay. So the second question is that in your outcome assessment, what about the conventional management? Because this was an add-on study. What I'm missing is that what happened with the conventional management in general of these patients. I mean, you mentioned sometimes that they take less, but maybe in some cases they took more conventional drugs.
So which conventional medication was mostly that you want to know? Huh?
Yes, in general. I mean, what I'm missing is that you describe exactly what happened with the conventional treatment of the selected cases.
So, sir, most of the time, the first line anti-epileptic drugs were given by the neurologist. So, first line anti-epileptic drugs were given.
Yes, my concern is that if you attribute certain changes that you observe after a year to homeopathy, but you don't give us insight into what happened with the conventional treatment, then that could be biased, you understand? Because maybe all these patients, or most of them, took twice as many conventional drugs. So maybe that explained why they were feeling better. So what I was missing a bit is a discussion also all the limitations here, that you have to be quite cautious to draw conclusions because there's no control group. So this could be a study that generates an hypothesis, but it cannot confirm a hypothesis because you don't have a control group. You understand?
Yeah.
Thank you, sir. Now, I may call upon the next speaker, please. Sir, do you have any question, Dr. Neeraj? Already we run out of time for the question
Time
answer
is
session.
running short, but I
Yes,
have
sir,
only
please.
one question to ask
Yes, sir.
from him. When he said that there are different mental states, one he has mentioned about emotional, behavioral, and intellectual mental state. So he has shown that 3 cases from tuberculinum were also there. So I would like to know on what basis you could give tuberculinum, on what mental base state you could give that remedy. Can you please comment, Chandraban, Dr. Chandraban, please?
Sir, the overall conclusion of these cases could not be done in this for this presentation, but the totality of case was formulated, and in which the all the symptoms were classified under emotional, behavioral, as well as cognitive mental state. So that's why the symptoms corresponding to varieties of these mental states were incorporated to formulate totality, but to specify which symptoms will be incorporated in what type of mental state, it will be difficult to present in this presentation, because I have to
Okay, it's okay. Thank
So
you.
we'll move on to the next speaker. I may call upon Dr. Abraham Ashfaq Ahmad Ubhare, and he's going to speak upon utility of biopsychosocial model in therapeutic management of anxiety disorders. May we move on to the next speaker. She is Dr. Ankita Sunil, and she's going to present on homeopathic management of behavioral disorders amongst children having scholastic difficulties. May I invite upon Dr. Ankita Sunil to kindly share her screen?
Yes, ma'am. Am I audible, ma'am?
Yes, you are audible. Kindly share your screen.
Okay, is this visible?
Yes, it is visible. You may start your presentation. You can switch on your video also.
Yes, ma'am. Okay. So, my topic is homeopathic management of behavioral disorders amongst children having scholastic difficulties. Let me first introduce myself. Myself, Dr. Ankita Telane. I'm a Part 2 MD student from ML Dhawale Memorial Homeopathic Institute. So, let us begin with the presentation. Sound mental health of a child is as equally important as his physical health, as we all know. When a child is in the 6 to 14 years of his age, that is when he's in latency stage, he has to deal with the big demands which are placed upon him. He enters into the latency phase and he starts going to the school, and where he is expected to behave in an orderly manner or to follow some rules, etiquettes, where he has to follow some authorities, he has to obey with them. And along with that, he has to perform exclusively well. It is expected from a child, obviously, that he has to perform well in his studies also. But what if he cannot perform well in his studies? It is seen that scholastic backwardness give rise to many behavioral problems and emotional problems in children. Scholastic backwardness usually produce feeling of inadequacy in children. Epidemiological data suggests that about 12 to 51%, with the average of around 29% of the world's children suffer from emotional, behavioral, or other mental problems. But despite of the high prevalence of the psychiatric illnesses in school-going children, very less studies have been carried out for studying their behavioral disorders, especially oppositional defiant disorder and conduct disorders. So my aim, so to bridge the gap between these two, my aim was to study the action of homeopathic medicines in improving behavioral disorders in children having scholastic difficulties. So methodology used was 30 cases were chosen by simple random sampling. It was an uncontrolled experimental study. Children between 6 to 14 years of age who already had some scholastic difficulty were chosen. They were screened using CBCL, that is Child Behavioral Checklist, to check for the psychological and other problems. Then they were diagnosed using DSM-5 and ICD-10 criteria, and the diagnosis was made. case was taken, totality was formed, and after repertorization, homeopathic medicines were given. After 6 months of follow-ups, changes in intensity of symptoms of conation, that is behavior, cognition, and affect, pre and post-intervention were noted, and it was analyzed using PAIR-T test. Let us see the results. Among the all 30 cases, it was seen that attention deficit hyperactivity was the most common behavioral problem seen in children having scholastic difficulties, which contributed about 80%, followed by conduct disorder, which contributed about 13%, and oppositional defiant disorder for about 7%. Homeopathic remedies which were prescribed after forming totality and repertorization, it was seen that mineral group of remedies were the highly indicated remedies in such cases, among which natrum group of remedies were the most commonly indicated remedies. Natrum mur, natrum silicata, natrum phosphoricum, natrum sulf were the indicated. After that, nosures were highly indicated. It was seen that about 6 cases out of 30 children, 6 cases were given medorinum, as you can see here, and 3 cases were given carcinosinum. After 6 months of assessment of change in intensity of the symptoms of conation, that is behavior, cognition, and affective problem, that is emotional problem, it was seen that conation problem, behavioral problems were improved by 71.92%. 71.41% improvement was seen in emotional problems, and about 52.94% improvement was seen in cognitive problems, which is comparatively less if we compare changes in conation and affective problems. So it can be concluded from this study that behavioral disorder amongst children having scholastic difficulties can be improved with homeopathic management, and homeopathic remedies are more effective to bring improvement in behavior and emotions as compared to improvement in intellectual functions. As we all know that children's health is a cornerstone of nation's progress, and it is very essential for all of us to promote mental health, as these children are very vulnerable section of the society and about child mental health matters. So I thank you, LMHI and my institute, LMHI, for giving me this opportunity to present my study. Thank you so much.
Thank you, Dr. Ankita. Now I may request the esteemed chairs to kindly please ask any questions if they have.
Yes, thank you very much for a very clear presentation. Also, my compliments for your slides, for your presentation with lots of visuals, good clear font types. So very good marks for presentation. My question is, was this data collected retrospectively or prospectively?
So this was done prospectively.
Was collected prospectively?
Yes, sir.
Okay. And so what was random? What was the sampling then? Can you explain that again?
It was simple random sampling method, sir.
But how do you random sample? If you don't have a control group and you just prospectively follow a number of cases?
Okay, so the patient who used to visit our OPDs, among them, children who used to present with scholastic difficulties were randomly selected, and then they were screened using the child behavioral checklist.
So you're saying that just from the clinics, some of them were just randomly picked up for this study, and
those
others
who
were
had
not?
scholastic difficulties. Those
So
who
you
already
did-
have academic problems. Only
So you
those
did
children.
not. I'm just trying to get my head around what was random. How did you say? So you're saying there were 10 children, of 10 children with scholastic difficulties treated just by chance at certain days, randomly some were selected?
Yes, sir. Amongst all the scholastic, all those children who had scholastic problem, some they were randomly selected and then they were screened. So it was found that they have some behavioral problems.
Okay, I'm still not completely clear about it, but this is definitely always, when you talk about random, it's very important to explain exactly what you have randomized.
Okay,
And
sir.
also it's important to mention that it's a prospective study.
Yes, sir.
And uncontrolled experimental, that's a contradiction.
Okay.
Either a study is experimental, that means there is a control. So they're just wording issues, but they are important because the scientific aspect is always about what population did you study and how did you sample your population. So you need to focus really on that. But
Yes,
otherwise, compliments for a good presentation.
Thank you, sir.
One question from my side, Dr. Ankita.
Yes, sir.
It was taken up nicely under Dr. Sunita Nikum. I know her personally also.
Yes,
Anyway,
sir.
so the question is that while assessment of the cases, when
Yes,
they
sir.
were improving, so what tools have you used? What questionnaires, what tools you used? As you have mentioned about CBCL for screening, can you
Yes,
please
sir.
comment upon that?
While this study was designed, it was decided that I would be using CBCL as pre and post assessment questionnaire. But because of the COVID scenarios in between, using CBCL, which already contains 113 questions, was a bit difficult. So follow-ups were assessed using telephonic conversations. Hence, the intensity of symptoms, like symptoms were given intensity in +1, +2, +3. And after intervention, when we used to take follow-ups, it was noted again as a +1 reduction, +2 reduction, +3 reduction in the intensity of symptoms. Then the difference between the intensity of symptoms were noted and the data was analyzed.
Okay, thank you.
Thank you, Dr. Ankita.
Thank you,
I
ma'am.
think Dr. Mohammad Ibrahim Ashfaq Ahmed Ubhare is now ready with his presentation. I may invite upon him and he will speak his presentation on utility of psychosocial model in therapeutic management of anxiety disorders.
So let me introduce myself and why I chose the study. Am I audible now?
Yes, you are. Please carry on.
Yeah. So we all know how distressing and crippling anxiety is, and I was a victim of anxiety. I suffered blood and mutilation phobia. I tried hard, but I couldn't overcome my phobia. The laborious and strict routine at my PG institute and hospital forced me to repeatedly face my fears, and gradually I overcame it. Here, exposure therapy worked for me. That time I didn't know it's exposure therapy. So after finding out what worked for me, I wanted to figure out how to help others like me. So quickly we'll see what is anxiety. Anxiety disorder is a morbid state with disabling anxiety, defined as a feeling of apprehension with autonomic disturbances. A number of studies, sample studies are done on the genesis and evolution of anxiety disorders, and varied therapies and medication have been proposed to counter them. Past and current treatment modalities have proven effective only up to a certain level. An integrated holistic approach has yet to be effectively formulated and practiced. The aim of my study is the utility of BPS in therapeutic management of anxiety disorders. The BPS is biopsychosocial. Engel's biopsychosocial model is an interdisciplinary model that looks at interconnection between biology, psychology, and socio-cultural environmental factors. It examines how these aspects affect human health and disease. So here I have done an uncontrolled experimental study of 30 patients suffering from anxiety disorders as per DSM-5 or ICD-10 criteria. Duration of my study was 18 months, and assessment was done using Hamilton Anxiety Rating Scale. Simple random sampling was done, and the biopsychosocial factors were analyzed. Out of the anxiety disorders, most commonly, as you can see in this, my screen is stuck for some reason. I can't move it. But if you see this graph, diagnostic graph, so out of 30 cases, 15 are suffering from generalized anxiety disorders, 5 from illness anxiety disorders, and 4 from panic disorders, 1 each from alcohol-induced anxiety disorders arising out of general medical condition, social anxiety disorders, agoraphobia, claustrophobia, and mixed anxiety and depression. So after analyzing the biopsychosocial factors, the commonest biopsychosocial factors which we could find were in biology, the pregnancy, alcoholism, general medical condition, psychological factors or causes were fright, grief, anticipation, shock. I think my slide is stuck somewhere. I'm unable to scroll down. derived as the primary causes of development of anxiety. And this graph is showing the diagnosis. So after understanding these biopsychosocial factors and studying each case in its depth individually, we could chart out therapeutic problem resolution or therapeutic planning for them. If we talk about the medicines, all 30 cases were administered constitutional medicine. 4 cases required on and off management using a phasic remedy like aconite or arsenic. 1 case required intercurrent remedy thuja. So after assessing the need of the case, we came up with like most of the patients were having maladaptive thoughts. So thought challenging was one of our strategy. Mindfulness, biofeedback, exposure therapy. We also use a person if he is religious, how could we use it for meditation? Lifestyle modification, self-revelation, positive psychology, all these treatment modalities were used along with our homeopathic medicines. And then for measuring the grade of severity, we use Hamilton Anxiety Rating Scale. So Hamilton Anxiety Rating Scale, it is used to assess the severity of anxiety symptoms. So it is a 14-item scale which measures psychic anxiety as well as somatic anxiety. The gradations are from 0 to 4. 0 means no complaints and 4 means severe symptoms. So mild anxiety is less than 17, mild to moderate is 18 to 24, and moderate to severe is 25 to 30. So before initiating the treatment, 26 out of 30, 26 patients were having moderate anxiety and 4 were having severe. After the intervention, this was collected after 1 year of intervention. 27 patients were having mild anxiety, 2 were having moderate, and 1 still had severe anxiety. So here we can conclude that an individualistic integrated approach of homeopathic medicines along with non-pharmacological allied therapies proves to be effective in reducing the distress of patients suffering from anxiety disorders. So it kind of augments the normal homeopathic medicine, the therapeutic resolution. Thank you so much for letting me present my case.
Thank you, Dr. Ubare. Now over to the esteemed chairs to please open the questions.
Yeah, thank you again. Thank you for a clear presentation, also very concise, very clear, also poster visuals. So full marks for that. Again, I have to mention the experimental, uncontrolled experimental. It doesn't make sense. It seems to be a misunderstanding with some of the others as well. The fact that you have done some random selection of cases, so that you've randomly sampled some cases, that doesn't make it an experimental study. Effectively, what I understand, most of you have done, also in the previous presentations, is a prospective observational study. Yeah, so your design is observational, so meaning non-experimental. But with the selection of cases within that observational study has been random. Yeah. But apart from that, I think it's interesting work. I think it illustrates the importance of an integrated approach. So I don't have major comments. Obviously, we cannot attribute these effects only to homeopathy. But overall, I think it's interesting work to demonstrate the benefits of an integrated approach.
So, like, I would suggest for future workings on this subject, like we can have 3 groups. One having only one intervention is only the homeopathic medicines. For the second group, intervention shall be only the therapeutic intervention, and for the third group, it should be both in homeopathic intervention as well as allied therapies. So we'll able to see the comparative results.
No, here
Yes,
I would like
so-
to, sorry. Here I would like to comment one more thing. Like when you are planning to go for future studies, you can take one group as placebo without anything, right?
Right.
So just to get to compare to the homeopathic as well as the other ones. Yeah.
Right, sir. Thank you, sir.
Thank you, sir. Dr. Deepika, would you invite the next speaker?
Yes, ma'am. And I think our session has been quite captivating as yet. All the slides have been quite appealing. Now, let me welcome our next speaker, who is Dr. Shahja Abdul Rahman. And he is going to present a case report on huge anal condyloma improved with individualistic homeopathic treatment. Dr. Shahja, please.
Now it's okay.
Yes,
Yeah.
sir, you may start.
Good afternoon, everybody. My respected LMHI judges and crews. I am Dr. Shah Jahan. I am working in Fatima Medical Center, Alain, in UAE. Formerly, I was working in Nehru Homeopathic Medical College, Delhi. I am going to present a case of a huge anal condyloma. It's a surgical case in a 22-year-old male, markedly improved with the individualized homeopathic treatment. It's a case report. I got this case as a referral by one surgeon working in a nearby hospital. He told me, I tried cauterization in this huge condyloma, but it is not responding. So I may have to go for shave excision. But before that, if you want, you can have a try on it. So I agreed the case when I saw it was a very huge condyloma as shown in the picture. So
Can you zoom in, please? It's very small, the letters.
Sorry, sir.
Can you zoom in on the? The letters are too small. I can't read them.
Enlarge your slide, please.
Left this size, slide.
On the left, where
On the left with the
looking
magnifying
glass.
glass.
Third
the
icon
top.
on the left.
Lens with the plus mark. You can tap that. Click on that. On the top of your screen, poster, left, go left, go left, go left. Yeah. Lens with the plus mark. Left. Yeah,
Yeah,
this one.
Good.
It's visible?
Yes, slightly better.
Though now that mark has disappeared.
Yes.
It's okay. You can
Okay.
start.
Can I continue?
Yeah, please.
Yes.
Yeah. When I saw this patient, so the growth was very huge and it was almost occluding the anus, and the patient was having too much pain during defecation, and he was very restless and with burning pain. So what is condyloma? Condylomas are anal warts, growth arising from skin around the anus or in the lower rectum. It's caused by human papilloma virus. It grows rapidly and assumes huge size and cauliflower-like appearance. Surgery is the treatment of option in very large growths and growths which extend into the anal canal in conventional medicine. Objectives: to observe the efficacy of individualized homeopathic treatment in surgical case condyloma, which almost occludes the anus, causing severe pain and obstruction during defecation. Materials and methods: a 22-year-old male presenting with severe pain during and after defecation and difficulty in passing stool since 1 month due to cauliflower-like growth at the anal opening. Diagnosed as condyloma from the surgery department of NMC hospital. Based on the appearance of growth and other constitutional factors, homeopathic treatment was commenced with a single homeopathic medicine and is under follow-up since last 6 months. Result: based on the present totality, that is anxiety, restlessness, and burning pain, considering all these things, I started my treatment with arsenic alb 200. From the very beginning, it responded very well. It almost reduced his pain, especially burning pain. That was partly because of the growth and partly because of the procedure that the surgeon tried. It did reduce the pain, but the growth was not subsiding. In fact, it was growing. So I switched over to Staphysagrija by considering two important points. One, that growth has a special sensitivity that was there right from the beginning of the growth. And second point, his work atmosphere. He was under tremendous stress because of his rash and rough dealing of his boss. He was in a state of mild depression. So by considering all these factors, I started Staphysagrija 200. It didn't respond well, but since the symptoms were persisting, I switched over to 1M and later on to 10M. And once I started giving 10M, it started reducing drastically. Over a period of 4 months, the swelling was almost reduced as shown in the picture. And my conclusion, conventionally, surgery is the treatment of option for big anal condyloma and growths which grows into the anal canal. But it will not eradicate the virus. In addition to that, the risk of getting scar and strictures are there. Homeopathic treatment is well known for the treatment of viral warts, which offers complete recovery by internal medication without doing any procedures. Thank you, one and all. Thank you, LMHI, and for giving me an opportunity. And thank you, Dr. George Matthew, for motivating me to come up with this presentation. Thank you all.
Thank you, Dr. Shahaja. It was a very well presented case. Now, may I request our respected chairs to ask a question?
Well, thank you. It's a very impressive case. In terms of the presentation, what I'm missing really is a timeline, a bit more. I mean, there's a care guideline for clinical case reports, and the idea is that you give a timeline that you say, well, over which period, what kind of remedies were given. But generally, impressive case. My main question is that in terms of the what's known about the spontaneous resolution of these types of warts, because there's no control, it's an impressive case. So the question is really, was this caused by Staphysagrija? And to answer that question, we need to answer the question, how likely is it that something like this is going to spontaneously resolve in 5 months, as you've shown here? Have you looked into that?
But we cannot think in this particular case, this specific case like that, because it was growing day by day. And in the beginning, the suffering was very high and the patient was really in a very restless state because of this sensitivity. He cannot sit, and he was really moving about because of the burning pain and the sensitivity of the part. It touches, whenever his clothes touches that growth, it really hurts. So that was the time, I think, the acute homeopathic efficacy of homeopathic medicine in the management of that acute presentation. So my selection of arsenic albu was apt at that time because it did respond really well and it removed the acute sufferings. But the growth was still growing day by day. And since I started Staphysagrija, 200, 1M, and then 10M, when I started 10M, it started responding very well. That shows the potency is also very important in homeopathic prescription.
Yes, but my question is that you assume that it was a response to the Staphysagrija, but to address that question, you need to understand the scientific literature on what is is there a spontaneous regression sometimes of these types of warts? Because you need to look at alternative causes in order to be more confident in your conclusion. You understand?
Yes, the possibility is there. That possibility cannot be excluded. But when we watch and observe the case in front of us, we can tell that it's through our medication it happened.
No, but what I would like to hear is that in this case, you study the literature and you say, well, spontaneous regression of warts of this size is extremely rare or is common. If it's common, then we have to be more careful with our conclusion that it was due to Staphysagra. You understand? So you need to study the literature to position your own conclusion, how dramatic this case is and how likely it is that it's causally attributable to the Staphysagra rather than spontaneous regression. And so because that means you approach your case more scientifically. And so within the home case care guideline, there's always a very strong emphasis on, are there any potential other explanations for the changes you see? And so my main point to you is just a suggestion for amelioration, is that you always have to ask yourself that question with any case and also with this case. But very, very impressive.
I understand. Thank you, sir.
I have one question. You would have used Dr. Shahjahan VAS score for rating the pain, which has reduced after arsenic album. Second point is that did you take into consideration the miasmatic point? Because condylomas, as Henneman has mentioned, is a psychotic growth. So have you ever thought of intercurrent Thuja-like medicine to stop the recurrence, or sometimes it may regrow after some time as it has spontaneously regressed after Staphysagra? So could you think of anti-miasmatic any point of time?
Yes, sir. And in fact, Staphysagra itself is an antipsychotic medicine.
No,
and
that's true.
as you said, this condyloma growths are classified under psychotic miasm, and I am thinking of giving Thuja for maybe after 1 or 2 visits. I may switch over to Thuja in order to complete the case, and I have a plan to go for a blood for immunological study also, whether the presence of virus is still there or not, because this is human papilloma virus.
That's true. For future studies, you could use VAS score for analysis of the pain, from where it is reducing, how much it has reduced, and finally where the case stands now. Yeah, thank you.
Thank you, sir. Dr. Shahjahan, Dr. Sameer Chaukar would like to ask you a question, but I would request Dr. Sameer to please keep it real short. All right, sir?
Yes, thank you, Dr. Deepika. I just wanted to talk about the remission part, which Dr. Robert was talking, and Dr. Shahjahan also. I wanted to say that many a times, even we have seen cases of warts and genital warts go with the appropriate homeopathic remedy. And Dr. Shahjahan, I'm sure the physical generals of these patients, he was doing very well with his sleep, sleep, excretions, his appetite and everything. So if physical generals are doing better with the constitutional remedy, then this is not a remission, this is a cure. So I support you, Dr. Shahjahan, and this, I feel, because I can identify you with my cases, that whenever I treat constitutionally, though there are, many people would say that there is a chance that there could be a spontaneous remission, but when there is a remission, the physical generals are not better. That is what I have observed in my practice, and this is what I think. So, Dr. Gupta, sir, do you agree with me about this?
Yes, definitely.
So,
yeah,
Dr.
they have to be taken into consideration.
I just wanted to ask you, how are the physical generals of the patient? Was he doing well as far as the other generals were concerned?
Me?
Physical generals, like his appetite, sleep, stools, urine, how are his general symptoms along with the constitutional?
Actually, that areas were not much affected. He was having terrible pain, type of burning pain, and restlessness, and a lot of anxiety because he cannot pass stool very well. There was difficulty in passing stool, and of course, because of the growth, sensitive growth in anal region, he cannot sit, and the clothes constantly rubbing that part, which was constantly hurting. So that was his main issue. That got resolved with arsenic herb, and later on the growth got reduced with the Staphysagra.
Oh, thank you, sir. Thank you.
Okay. Thank you, Dr. Sameer Chaukar, for your query. Thank you, Dr. Shahjahan. You answered really well. So let's proceed over to the next presenter of this session. May I invite Dr. Tanveer Abdul Hamid Sheikh from India. He is going to present an observational study, which is the utility of BPS model in involving the therapeutic problem definition in geriatric depression. His ID is 401.
Hello.
Dr. Tanvi?
Yeah, am I audible?
Yeah, you are audible, you are visible.
Yeah. Hello, everyone. My regards to the jury, the coordinators, and everyone who is watching this live. So I'm Dr. Tanvi. I'm an alumni of Dr. MLW Memorial Homeopathic Institute. And this is my topic, utility of biopsychosocial model in involving the therapeutic problem definition in geriatric depression. So you may find it a bit similar to a presentation done previously, which was on anxiety disorders. So now let's understand about this geriatric age group. Now we know that depression is a rising entity, but it has been silently affecting many elderly. So why is this, and what are the challenges faced in this? So the major challenge is the rising population. So we see the 2017 statistics of WHO. It states that the global elderly population is 7%. And in India, if you see the 2011 census, it says the elderly population has risen to 8.5%. So this is the first challenge, followed by the major things like denial and neglect. And we see that there is extremely poor awareness of mental health in the society, lack of care, issues like retirement, housing, or any other financial issues. So this study, it is a prospective case series study of observational type, which was conducted on 30 patients of geriatric age group. So the patients were basically selected, they were assessed through a geriatric depression scale, which is a 30 questionnaire scale. And those who had positive scores on the scale were selected for the study. So in the scale, we have two categories, that is mild depressive and severe depressive. Later, the patients, they were assessed and diagnosed as per the ICD-10 criteria, and the final diagnosis was made. Then comes the main procedure, which is an in-depth case exploration. So here, as you see, as I mentioned in the methodology, after the case exploration, the main objective, which was to derive the therapeutic problem definition using BPS model and explore the multi-factors which act as causative or maintaining factors in geriatric depression. So for that, we needed the understanding of the various factors, that is the biological, psychological, and the social factors, which were elicited through homeopathic case definition, and a therapeutic problem definition was evolved. Now, what is a therapeutic problem definition? So basically, before intervening in any way, we need to understand the problem. So we define what is the problem. So it is the understanding of the issues the person is facing. That can be the clinical state, the behavior of the patient, the signs and symptoms, and the complete picture basically. So here we see, you can see at the top right corner, where I have mentioned a figure showing the types of depression which were found in the study. So I found that the diagnosis ranged from mild, moderate, severe depressive disorders, dysthymia, as well as mixed anxiety with depression. Majorly, the patients fell under moderate depressive disorders, which accounted for 33%. Now let's come to the result which was obtained. So the clinical conditions dealt, as I've already mentioned. So these are the clinical conditions. Now let's come to the various factors. Biological factors accounted for 63% in the 30 cases, where one important finding was found that severe depression was seen in cases which had depression post cerebrovascular accident, that is CVA, and it accounted for 10%. So basic reason could be the organic brain damage. And the another important finding was obtained was the family history. A strong family history led to a severe depression, and the family history, especially of mood disorders or psychotic illnesses, led to severe depression. Then we come to psychological factors. So here we have predisposing factors, maintaining factors, as well as positive factors. So overall, it accounted for 93%. Dispositions acted as a predisposing factors, and the majorly seen dispositions were attachment and responsible, and the positions majorly seen were grief, suppressed emotions, and anticipatory anxiety. And at the social level, we found the major factor was the death of the family member, which could include the death of spouse, death of a child, majorly, and separation, followed by financial loss. So now let us understand the utility of these factors in evolving the therapeutic problem definition. So the understanding of all these factors helped us to understand what treatment could be indicated. So the cases where there is a prominence of psychological factors definitely require the constitutional remedy. And we see where there is a strong fundamental load, and anti-miasmatic remedy plays a major role. So 50% cases showed the indications for anti-miasmatic remedies. While if you see the therapies in counseling was indicated in 43%, and other therapies like CBT and behavioral therapies was indicated in 17% cases. Regarding the social factors, we see that the factors are very difficult to reverse, and it acted as a strong maintaining factor, and which is not reversible in the domains of the physician. So here at the right, we see the graph showing utility of BPS in the treatment. And here I have mentioned family history and comorbidity. The majorly seen comorbidities were DM and HTN, which and followed by cardiac illnesses, alcoholism, and mood disorders. DM and hypertension accounted for almost 50 to 60% as a predisposing factor, which was similar to the previous studies. And CVA was found as a strong causation for severe depression. So here I have made a graphical representation of the biological factors involved in the TPD, the psychological and the social. Here we see physical illness, psychiatric illness like substance abuse, neuropsychiatric illnesses, mood disorder, psychotic, developmental, CVA, and in psychological and social, just the way I have mentioned above. So this image which you see in the center, the BPS model which was proposed by George Engel, he has proposed this diagram which is a multidisciplinary model showing an interaction between the various factors. Thus we see
Tanvi,
that,
sorry, but
yes.
I think we have run out of our time, so you should be
Okay,
fast.
fine, I'm done. So this is the multidisciplinary interaction of the factors which was obtained in the end. Yeah,
Okay, thank you so much for sharing the slide. And I will request our dignitary Dr. Robert Van Haslen if he has got any questions to ask her.
No, because I think we've had similar presentations using the similar model, but I do want to remark that you've done very well on the mentioning that this was a prospective case series. So that's the design was much more clearly presented. And so my compliments for that. And otherwise, I think the overall visuals were very clear. So no further questions.
Thank you, sir.
Well, I have a question for Dr. Tanvir.
Please go ahead, sir.
When you have mentioned about phasic remedies, can you comment upon what were the basis of utilizing these phasic remedies? One. Second, under the psychological factors, have you ever taken these, areas like diseases like terminal diseases, cancer, and other things? Debilitating terminal diseases, HIV, AIDS. Did you come across those in your study of TPD?
So regarding the phasic, there are sometimes we have cases where the patient comes in a very aggravated state and present with suicidal thoughts which are difficult to control at that time. But if we take the whole picture, we have an idea that the constitutional is not the overall development shows some remedy, but at that particular moment we have to address it, which may come with the remedy may be different. So at that time we have to prescribe certain things like Oromet, and then gradually as the phase settles, then we take then the patient comes to a better stable state. So we take the detailed information And if the remedy, if we understand that this is the constitutional remedy, we continue with it. But if there are other things we come to know and we realize that this is not the final constitutional remedy, then after the phase it, we prescribe the constitutional remedy. And regarding this terminal illnesses, I have not come across such illnesses during my study.
But it's very
So,
important area where, one has
yes,
to
sir.
take into consideration.
Yes, sir.
Terminal diseases are having directly linked with the depression,
Yes,
and
sir.
that you could have taken. Anyway, it's good study.
It was considered during the while we were referring for I was referring the literature, but then such cases were not available in our OPD. Hence, we don't have the information in the study.
Okay. For future, you can take into
Yes,
consideration, right?
definitely.
Yeah. Thank you.
Thank you.
Thank you, sir. Thank you, Dr. Tanvi, for your presentation. Now, all right. I'll request the next speaker, then Dr. Omkar Deepak Anavkar. He'll present a case report on exploring role of homeopathic intervention in structural and functional improvement in a child with Duchenne muscular dystrophy. His abstract ID is 286.
Hello, all. Can I start now?
Yeah, please do.
Yeah. So my topic for our poster presentation is exploring the role of homeopathic intervention in structural and functional improvement in a child with Duchenne muscular dystrophy, a case report. So basically, Duchenne muscular dystrophy is an X-linked recessive hereditary neuromuscular disorder in which the affection at X21 locus, which is one of the largest gene, is an abnormal. Usually in modern medicine, there is no classical medical cure for this disease nor any medications to slow the progress of the disease. Hence, as an homeopath, we should know that how we can approach to this case. Hence, I would like to share what actually I have done in my case study. Our case was a 10-year-old male studying in 5th standard. He came to us in 2017. There was no any significant family history in the case. When we asked for the chief complaint, we come to know that he was unable to walk since 2 years, and since 6 months he was unable to stand or unable to raise his hands. When we inquired for the evolution of the complaints, we came to know that there were delayed milestones at the gross motor level. Sitting was at 8 months, standing was 1.5 years, walking was 2 to 3 years. He was going to the nursery normally by walking. But when he was 5 to 6 years of age, his parents observed that there were frequent falls. He was unable to stand slowly, gradually. And hence he got investigated and they come to diagnosis of Duchenne muscular dystrophy. Along with these chief complaints, he had complaints of recurrent URTI every 2 to 3 months with high-grade fevers from exposure to any cold or drinking cold water or any change of weather. Additionally, mother also had a bad obstetric history, had 2 previous IUFD, 1 induced abortion, and she was also torch positive when pregnant with the patient. At physical examination level, weight was 21 kg. His CNS, especially at the power level, upper limb, where he had some power at 3, but lower limb, the power was 3. The investigation with which he had come to us, the CTK level was almost 8,906. So this was the clinical state. Patient as a person at the physical level, we could see that the appearance was fair and fairly. There were no any specific desires, but at aversion level, he had specific aversions of meat, fish, chicken, eggs, sweets. Perspirations were there at the level of palms and soles. Classically, he had more dreams about ghost or ghost in the dream. Hence, he used to get frightened from it. And along with that, he was thermally a chilly patient. The most important and the characteristic thing which you observed to know and individualize the patient was his mental disposition. At mental level, we found that he was very fearful child. He had fear of dark, strangers, dogs, even the insects, cockroaches, any type of fear. And his response to that fear was that he would shout loudly looking at those things. Also, they also shared that there was fear of hideous faces. Example, if anyone would color their own face and he would come to him, he got frightened. Especially in India, in festivals of Holi, he used to get very frightened. Another thing, he was very fearful of the statues of the deities of the god in temples. So this was very classical. Along with that, he had irritability and anger contradiction as well. So considering these all the three states, we made a totality of fear looking at hideous faces, fear of dark children, fear of strangers, fear of dogs, even the shrieking children, along with the classical characteristics, physical modality, and the general pathological general with weakness at muscular level. So stramonium came up considering this, and hence stramonium was prescribed initially in 200 doses. Later on, it was increased to 0 by 1, 0 by 2 daily, seeing the response, and now currently he is on TDS. So we could see at the result level. At the result level, over a period of 4 years, we have a good extensive follow-up. In the follow-ups, we observed that there was very first improvement in the nature of the child, in the way, in the functional nature of the child, or the way in which he was very fearful. So we saw the response that the fear was very better, or it was improved in the very first 6 months of the treatment. Along with that, irritability level was decreased, the obstinacy or anger was also decreased. Mother said that he doesn't get angry very frequently nowadays. He is trying to adapt to the situation which he's suffering from. Also, the interest in the studies improved. He used to take interest in study and try to function. Also, talking with the strangers, it was very fearful for him. So he used to now, the confidence level increased, and he used to talk nicely with the persons on phone. He used to talk to his uncle, aunts at everywhere, and the level of liveliness also increased in him. Along with that, we saw that there was mild increase in the power of the upper limb, and classically from the, these are the CPK levels over a period of years. Initially, when we had composed, it was range around 8,000 to 12,000. It was the highest, but gradually over every 6 months we were doing CPK level, and latest is of October 21, which was around 1,000. So there was reduction in the CPK levels in these 4 years, and along with that, very marked improvement were at the associated complaints, that is the respiratory complaints of the child, which we would see in the very first 3 to 6 months only. That mother from our follow-up observed that the recurrent tendency to fall ill was decreased. One other thing, most important challenge in this case was that this was a long distance case. We are in Maharashtra, Mumbai, and he was from Uttar Pradesh. So the conversation was there on usually on call. So that was also one difficulty, but the WhatsApp and video sharing, the telemedicine was very helpful for us to understand the follow-ups of the patients. Hence, ultimately, from this entire case, we were able to know that or to understand that homeopathy has a role, especially at the level at some amount of that it can slow down the progress of the disease at the level of destructions which is happening at the muscles, right? Along with that, some amount of functioning, that is the at the functional level, at mind level, at behavior level. So there was marked improvement in it, along with slight structural ability. Though we consider that over a period of 4 years, the damage which was done because
Dr.
patient had.
Omkar, you are
Yes,
exceeding your limit.
Yes, ma'am. I am just
Please.
concluding
Yeah.
this. Concluding
Yeah,
this.
please,
Yes.
please do. Thanks.
So only the limitation was that at the structural level there was very limitation, because patient had come to us at 10 years of age, and he had started the destruction at 5 years, muscle destruction at 5 years of age. So we could conclude that it helps, homeopathic intervention in this case helped to slow down the progress of the disease, because it improved the susceptibility and adaptation of this patient to the disease itself. Thank you very much.
Okay, thank you, Dr. Omkar. Now I would request our esteemed chair, Dr. Robert and Dr. Neeraj, to ask some questions.
Yes, thank you for presenting an interesting case. I was wondering, the stramonium how was this stramonium prescribed over this follow-up of 4 years? Was it repeated? I missed that somehow.
Yes, sir. Yes, sir. Initially, it was given only once a week for initial 2 to 3 months. When we started seeing the improvement, but the levels of CPK were not decreasing. So hence we shifted that we got understand that we have to increase the potency, but at the level of disease, this is a structural irreversible. Hence we had to prescribe it more carefully. Hence we chose the LM potency, and over a period of time, 0.1p was given weekly, slowly, gradually. Over a period of months, it were increased, seeing the response.
Yeah. I mean, it's a very interesting case. I think in terms of the presentation, there's just too much on it. It's a bit too loud, too much information. Makes it
Yes, sir,
harder.
sure. Yes, sir, this input I will keep in mind.
But what I recommend is that you apply the Monarch causal attribution inventory, because this really touches on those kind of things that we've seen in the other case as well, is that if this ward in the previous case, if it was only the ward that has improved, but no other mental symptoms and the totality of the case not improved, then it could have been a remission. So I think it's very interesting that you do refer to this response at the mental and emotional levels. And so that would be captured in this Monarch, because the Monarch does not ask just, well, did the main symptom improve? The Monarch asks, okay, did any other symptoms improve? And so this would give you much more objective basis to be confident in your conclusion that, well, this improvement might have been due to the homeopathic medicine. But thank you for this case. Very interesting.
Thank you, sir. Thank you very much.
Dr. Neeraj, sir, do you have any question to ask?
Yes, sir.
Yeah,
All right,
it is
sir.
a well taken case, but I would like to say a few things like in DMD, Duchenne muscular dystrophy, actually the mean survival year is about 24-25 years. So a long follow-up is required in these kind of
Yes,
cases.
sir. Yes, sir. Sure.
One thing. Second, if we would take miasm into consideration, because in this case we did not find any kind of family history which was positive or something of that sort.
Yes, sir.
But if we could take a miasmatic angle into consideration for long-term follow-up and management, that would be beneficial, I think.
Yes, sir. Sure.
And we should have to think about drugs like tuberculinum, because some of the symptoms are going towards tubercular miasm.
Yes, sir. Sure.
Right. So that is my suggestion.
Yes,
so if the case is with you, so you can follow up with that.
Yes, sir. He is with us only.
Yeah. Good.
Yes. Thank you, sir.
Thank you so much, sir. Thank you so much, Dr. Onkar, for your wonderful presentation. May we just move on our next presenter, and may I re-invite Dr. Vivek Gopal Bhai Vasoya, who is going to present an observational study on exploring competencies of homeopathic physicians useful for patient compliance in chronic alcoholics. Dr. Vasoya. Thank you. Dr. Kannada, you are audible.
Yeah. Okay.
Kannada's abstract ID is 267.
Which number, sorry?
267, sir.
Thank you.
7, yeah. Dr. Sunil.
Okay. So friends, today evening I'm going to share my case experience on treating celiac disease. I have 2 cases of celiac disease that came to our OPD. Am I visible? My audio is video is there?
Yeah, your slide is visible. Yeah.
Yeah, slide is visible. Okay.
You may show your video.
So actually, I got. Yeah. Okay. Good evening. So I got 2 cases of celiac disease. One was a lady aged 37 years old, and another was 16-year-old male child. First, I'll tell about the first case, the 37-year-old lady. She came to me after dealing with the disease, after having the disease, after getting diagnosed with the disease for around 12. She got the disease. She developed the disease lately after her marriage. And her presenting complaints, as it was diarrhea, abdominal pain, malnutrition. She was purely anemic, and other symptoms of malnutrition and weight loss, etc. And on case taking, I could find that she developed the disease after the marriage. And further inquiry, she told me that she had a misconception that she's about to marry a very rich man. That was the development of the case, and I'm telling you, she was about to marry a very rich man who is having a very good business and all. But once she got into the marriage, and once the marriage was over, she came to realize the reality that the man was nothing. He was not having any particular job. He was doing many small scale jobs and all. So that brought the patient into a very depressed state, very dejected state, and she had developed an immense anger towards her husband, which she could not express. So that was the key factor. So as per organon, we have to explore what is special, what is peculiar, what was the turning point in every particular case. So in that case, I took that particular incident because before marriage, she was perfectly fine. She was not having any problem. And after marriage, just because of this thing. And when I inquired that, she told me that this is the main thing. I had still that time she was having anger towards her husband, but that is not expressed. So that was the key factor. And I prescribed her Staphysagria 200 for on this particular totality. And after Staphysagria 200, she started feeling better. At that time, she was on gluten restriction, and diet was restricted. Gluten-free diet was, she was following gluten-free diet as per advice from AIMS New Delhi. So after that one, she started feeling better. I gradually reintroduced gluten-rich diet and observed her and told her to report me any symptoms if she is facing. But once she was on Staphysagria, she could very well tolerate gluten. So I continued with Staphysagria 200 along with placebo. And in the course of the treatment, once she developed dermatitis herpetiformis. At that time also, I waited for a month because the manifestation is coming out from center to periphery. So I waited for a month to for the lesion to go on itself. But it was not happening then, and then I raised the potency to Staphysagria 1M. With Staphysagria 1M, the lesion came down within one and a half month. The lesion came down, and she was doing perfectly well. And she was followed for another almost 1 year. From 2016 to 2019, I followed the case, and even now she's visiting the dispensary. She's having no problem, and she's taking perfectly normal diet with no gluten restrictions. That was the first one. And the second one was a 16-year-old boy. He was diagnosed with celiac disease at the age of 5. And again, she was on gluten-free diet, was as advised by other doctors. But in his case, his serum TTG was around 156 when it was diagnosed. That was at the time of 5 years.
Sorry, your screen is not taken up, so we are not able to see what you are showing.
One moment, I will do.
Kindly scroll up your screen, Dr. Sunil.
Yeah.
Okay.
So this is the investigation findings of the first case. Before and after, I think it is visible.
Slightly more.
The values are visible.
Yeah.
So for the first case, it was around 162. The serum TTG was 168, and you can see that the endoscopic findings also, that was confirmative to celiac disease in the first case. And in the second case, unfortunately biopsy was not there, but serum TTG value was very high. It was around 156 or so. And after treatment, it came down to 3.7. And in the first case, it came down 6.7 or so. So in both cases, the patient responded very well. In the second case, the person won phosphorus 200, depending on his general features. Means he was a very jovial person, very extrovert person. He with lot of liking for cold things, chilled items, salty food, and was extremely sympathetic. Considering all this point, I prescribed him phosphorus 200. And later on, phosphorus, it was followed by phosphorus 1M, and even until now, both the cases are doing well. So that was what I have to present today. And my suggestion to my fellow doctors that India being a India being a country with big burden with celiac disease, that we are adding around 10 lakh cases per year. So we have to offer a lot of things in case of celiac disease with homeopathic treatment. And the merit of homeopathic treatment is that we are providing the patient totally normal life with normal food that any other treatment, any other system of treatment cannot offer. So that's what I have to present. Thank you so much.
Thank you, Dr. Sohail. They were wonderful cases. I'll request our chairs to ask the questions.
Yes, one very practical question. The first case, the Stavisagra case, what happened with the anger of the woman?
Yeah, sir, that also got reduced. That also got reduced. Means she was able to control her anger. She was still controlling her anger, but that much feeling was not there.
But did she express her anger towards her husband?
Pardon?
Did she
I think
express
her mentality might have changed. Sir, I think her mentality might have changed.
Sorry, I didn't understand that.
Pardon, sir?
Can you repeat what you said, the last thing?
I think her mentality towards husband was changed.
Yes, but she was still angry with her husband, or not?
Every wife is angry with her husband, despite staphysagria. Sorry to say, in a lighter vein.
So the other thing is that what I miss is a timeline for the cases. Again, there is a home case care guideline, and when presenting cases, I think it's good to have sort of a brief chronology.
Yeah.
You refer to it verbally, but it's handy to have it visual.
Okay, actually, due to the space constraint for this making this particular poster, I had omitted everything, every such things, timeline and all.
Okay, yeah, that's always very difficult for a poster. It's I appreciate for a case that you need to make very difficult decisions. So it's good to hear that you have the timeline. Well done.
Yes, sir. Thank you. Thank you, sir. Okay.
That's great, Dr. Sunil. Dr. Neeraj, sir, you would like to ask some questions?
No, nothing in specific. Well done, Dr. Sunil. You have taken up nice cases, 2 sample cases. And as you have said that India being a larger community where these cases are very common. So we have to take your message, like constitutional medicines do help, definitely.
Yes, sir.
Yeah, thank you.
Wonderful cases. Wonderful cases are very well presented. Thank you so much, Dr. Sunil. Now we'll move ahead with the presentation. And may I please call upon Dr. Vivek Gopal Bhai Vasoya. And he will be presenting an observational study on exploring competencies of homeopathic physician useful for patient compliance in chronic alcoholics. His ID is 146. Okay. All right. So now, as we are about to conclude our session, I would like to request our honorable chairs, Dr. Neeraj and Dr. Robert, to please summarize the presentation.
Well, thank you very much. I think I'm very pleased to see that the overall level is very good of the presentations. I think we've seen several observational, prospective, and some retrospective observational studies and 2 cases. I think the observational studies are very important to give us an idea about the effects of homeopathy in particular types of conditions. And also the kind of realities in which homeopathy is used, because sometimes homeopathy is used as part or in conjunction with other interventions. And so that's very important, I think, to give us an idea about potential effects of homeopathy. It can help us to generate hypotheses, but there need to be a small note of caution that we have to be a little bit careful with the conclusions to say, well, now we have shown that these effects are all due to homeopathy, because these observational studies, they can have certain biases. So we always have to be careful the way we present the results. They can be promising, they can generate hypotheses, they can give us an idea about effect sizes, but we have to be careful to definitely conclude that this is due to the homeopathy. And I think these studies can be very important also to inform further trials. One of the presenters referred to this, that often homeopathy is used as an add-on to certain conventional treatments, like for instance with the epilepsy. And there you could do pragmatic trials where you say you add on homeopathy, all the treatment is the same, consultations are the same, but then half of these subjects would receive a placebo and half of would receive the verum homeopathy. So again, these observational studies are very important as a foundation for further work. And with regard to the cases, I'm really, what I'm missing is the monarch, because usually people present interesting cases where you think, wow, now that's a good Staphysagria case, or that's a good good case for that remedy. So I would like to see that monarch inventory, because this assesses not just whether the symptom got better, but it looks at the whole case evolution, and it gives us much more objective points for discussion to say, well, was this spontaneous regression of the wart or whatever, or can we really be confident that this was most likely due to the homeopathic medicines? But my compliments again for all the presenters, and so thank you very much.
Thank you, sir, for your viable feedback. Sir, Dr. Neeraj, sir.
Yes, all the presentations were very nice, excellent, I would say, except one or two. But anyway, there were some technical glitches with Dr. Vivek lastly. So firstly, Dr. Answara Dev, she spoke very nice on antisoric medication. Although the concept of use of antisorics in mental disorders has been already established by Dr. Harriman, but whatever she had done in a small study, that was very good, excellent. And I would like to know about her abstract ID also, because we have to evaluate. So certainly it was
Yes, sir. Yes, sir.
So,
Her abstract ID is 71.
Anyway, so secondly, I would like to say that as Dr. Robert von Haslin has suggested, to use Monarch and some other kind of tools for evidence-based studies. So now this is the time that we can utilize these kind of tools to evaluate our studies, so that we can validate at the end and can present in the front of scientific community how we are able to achieve the outcomes. Very commonly used Monarch, Narinjo criteria, and VAS scores. These kind of tools we can use in our day-to-day practice. It doesn't require very long-term understanding of these tests. So these are available, and one can very easily develop this acumen to utilize this. Secondly, all the speakers have done best of their efforts. They have excellently presented the cases, and the carry-home message is very clear. Whatever we may have to do, we have to follow the principles of homeopathy. Without that, we cannot achieve homeopathy. Even if it is an adjunct therapy, in some of the cases, like in epilepsy, one of the doctor has used as adjunct therapy, homeopathy. So in that also, we need to actually follow up our cases with the principles of homeopathy. And as Dr. Robert said, that we have to go with placebo, randomized controlled trials. That is going to be our future. So in homeopathy, slightly it is difficult, but still we can use our knowledge, our skill to go for these kind of observational and experimental studies. Mostly these were observational, but we have to go with the experimental studies also. Thank you very much. And we thank Dr. Amrit and Dr. Deepika for being the good moderators.
Thank you,
with
sir.
the smiling
Thank you so
faces.
much,
Thank you, sir.
Keep it up. Thank you.
Thank you, sir.
Thank you, sir.
The session has indeed been very captivating, I must say. And now we are about to conclude our session. Thank you so much, sir. Thank you to the chairs for your
Very good knowledge and take back message from
wise
the
words
chairs.
and very practical feedback, I must say.
Right,
Thank
sir.
you so much.
Thank you so much, sir.